bacteria that causes cholera likes to be in the tummy.
Mais bactéries qui causent choléra, elles méritent dans l'estomac.
Now, can you see bacteria?
Est-ce que nous avons bactéries?
How small is it?
Qui grosse c'est une bactérie?
Now, this bacteria started growing on wet poo-poo.
C'est que côté que bactéries ça grandit dans poupou qui mou.
And when we make poo-poo near the river and the water,
Par exemple, dans nos poupou bord rivière ou bien dans l'eau,
and it stays there for a long time,
il était là pendant pas quelque temps.
the bacteria grows on it.
Everybody here goes to church, and the religious leaders have a strong influence on people. So I thought that one of the best ways to reach people would be through the churches, religious leaders, community leaders, and voodoo priests.
We train voodoo priests, pastors, religious leaders, priests, so that they can spread the message to the population, because we see the best way to reach the population is through the church, because many people they attend church, and while they are here they can listen to the message and they can prevent themselves from getting cholera.
Mais avec ce séminaire-là, ça serait mieux. Demain, ou du moins, ça va diminuer le taux de la choléra, la quantité de personnes qui frappent par cette maladie.
Everything we do is under the guidance of the Pan American Health Organization. So we work in conjunction and with the Pan American Health Organization and with the Ministry of Health in order to make sure that the message that we're putting out is standardized and that we're not giving the population mixed messages.
We established 3 cholera treatment centers, one in VERRETS, one in Gonaïves, one in Saint-Michel. We've delivered supplies to those locations and doctors and nurses. We're also training the medical staff in these centers in cholera treatment, cholera management, patient management, trying to make sure that they can keep themselves safe, but also ensure the recovery of the patients that come to them.
Este paciente que vemos aquí vino en estado de shock por el grado de deshidratación que tuvo. Ya como vemos está bien recuperado.
Mais ça dit nous de Cholera, je dis non c'est un bagage son microbe lié. Son microbe c'est n'importe ça ou pas faire la bien ou attraper par microbe ça. Et ça fait faut toujours prendre précaution ensemble avec maladie ça pour pas entrer dans.
Et puis n'avant entrer dedans.
C'est de voilà.
And psychosocial first aid in areas. I know that Ro actually talked about that. The health cluster, it's a bit difficult because there are daily meetings now, but they are actually quite fundamental and essential for us to understand what our partners are doing. It's a good forum of communication with the ministry, with the UN agencies, with WHO, and a place to exchange information and to meet our colleagues with whom we can then plan better cooperation. International Medical Corps has a lot of experience with cholera and a lot of emergency response experience, and so what we see here is the need to try to first treat those who have been who've gotten cholera, but also then especially to try to prevent additional cases from occurring. And so that's kind of our treat and prevent strategy that we're applying in the country right now, and hopefully it'll help to reduce the morbidity rate and the mortality rate, the number of people who get sick and the number of people who die. So that's what we're aiming for.
Tenemos tenemos NAC.